New alarm bells ringing for all Americans and people from our own area after more than a dozen new Zika infections are uncovered in the state of Florida. TV 1055's Christine Sloan has the reaction from residents here and what can be done to protect yourself.
Pregnant women in our area on edge because of the Zika virus. Many canceling vacations to Florida and the Caribbean.
I'm actually from Puerto Rico too, so I have family that are there that I want to visit and I can't go.
Some airlines, including United, offering refunds to Zika affected areas because of the CDC travel warnings.
We check the CDC website.
Dr. Robert Ambler says while Zika-carrying mosquitoes only found in the U.S. in a small North Miami neighborhood, everyone needs to be cautious, especially in their backyards, to prevent mosquitoes not known to transmit Zika in our area but could be capable of it from breeding. That means getting rid of standing water everywhere from trash cans to lids.
It could be in as small as a bottle cap turned upside down that has a little bit of water in it. They can breed in there.
Clean gutters and keep screens on windows. Toss plates, spots that collect water over time.
Could be old tires.
It's not just standing water that attracts mosquitoes, but also grass and weeds. They use these shady areas to rest on hot days, so keep everything trimmed.
Do you do anything to stay safe from mosquitoes at home?
You know, we're big proponents of just spraying.
Again, no mosquitoes in the New York area found to carry Zika. Not advised now, but if it comes to it, there are mosquito fogs you can use outdoors. Always read the labels. Mosquitoes don't travel far, only 400 feet from where they're born. Staying vigilant can keep them away. In White Plains, New York, Christine Sloan, TV 1055.
And here now to talk about what's being done by medical professionals to combat the Zika threat is Dr. Jill Rabin. She's head of the Gynecology and Obstetrics program at the Hofstra Northwell School of Medicine. And welcome to the show, Dr. Rabin.
Thank you for having me.
So what is being done at your facility to deal with this threat?
Well, the first thing we do is we have a Zika program where we're able to test and follow women and their partners and their spouses who have potentially traveled to these areas or have symptoms or who are concerned about Zika, and we do that testing right at Northwell Health at the Manhasset campus.
What's involved in doing that testing?
So basically, people come in and we do a blood test, we do urine test, and we may keep that serum to be sure if that woman does not have symptoms or her partner doesn't have symptoms yet. We're able to compare that serum with a follow-up serum when they come in and see us in 2 to 4 weeks after that, and we follow those pregnancies. But the most important thing we do for patients is we reassure them that there is no cause for panic, and we make sure that we get them to the proper physicians, which are our high-risk doctors.
Are you finding anyone testing positive?
We are. We've had a couple of people test positive. We had one woman who tested positive, went back to her country. We had a partner test positive, and we've tested almost about 130 people at this point.
Well, we've seen this change where they keep expanding the amount of time that you should put off having a child. Now I think it's 8 weeks, went from 4 weeks to 8 weeks for women. And I believe I saw one report that now they're asking men to wait months if they've become infected before they attempt. I think 8 months, I think I read.
We ask women to wait 6 weeks and men to wait 6 months.
6 months,
8 weeks for women and 6 months for men. But this is a minimum. And what we tell people is prevention, an ounce of prevention is worth a pound of cure. We want people to make sure they get a pregnancy kit or make one, which is mosquito netting, wearing DEET or permethrin or the lemon oil eucalyptus. We want them and their partners to be wearing condoms. We want the partners to be wearing condoms or the female condom. We want prevention to be the watchword here, reassurance and prevention to prevent the disease, because as of now, we do not have a vaccine, although that is in development.
Yeah, I want to ask you about that, but how many people have you seen that you've tested, and has there been any increase since this alarm bells went off in Florida?
Since they have the travel ban now, the CDC, we have had basically a flood of calls coming in for people who are concerned. And as I said before, the most important thing we do is reassure people and get them in for testing if they would like to be tested. All pregnant women who are at risk should be tested.
And well over 100 people are being tested there.
Absolutely. Closer now. At this point, we're going toward the 150 mark in terms of testing.
So that shows you people are concerned about it. Now, you see here the spraying, and you mentioned all these remedies that are allowed. We've had the Attorney General in New York say, watch out for false remedies. That should be a concern, right? Self-remedies or anybody making false claims that are not authorized by the government?
There are only 4 substances which are approved by the EPA in terms of preventing Zika in addition to, of course, protecting yourself and staying indoors and light clothing, and that would be permethrin or DEET are the two big ones.
But this is still shocking to some people, and of course some people don't believe in pesticides or insecticides. There have been a number of studies. For decades we were told to avoid them, and there's been debate endlessly about what effect they have in the environment. In fact, when we had the West Nile virus outbreak here, we had wide-scale spraying like this on Long Island,
yes.
And then there was a big lobster die-off, and some people connected it. I don't know if it's proven or unproven at this point, but they stopped spraying as a result. Is there any worry that perhaps after this Zika threat passes that we're going to find there were negative consequences from all of this spraying and putting this DEET on yourself?
You know, downstream we always find that there are things we didn't know, but for now people have a choice. They can either protect themselves and prevent the disease, or they can be at risk for Zika, which can be and probably will be a much bigger problem than we're seeing.
So pick your poison?
Well, basically, we don't know for sure whether the DEET and the other substances are poisonous, but we do know that Zika does cause microcephaly and brain abnormalities, eye abnormalities in these infants. And the one thing you want to do as a mom and a couple is that you do not want anything to happen to your baby. So pregnant women will do anything to protect their babies.
Understandable.
So
God knows we don't want to see that.
That's right. Women who are thinking of becoming pregnant and their partners, the best thing you can do is make sure that you wear a condom, or have your partner use a condom or use a female condom every single time. Okay,
well now we've seen this fight in Congress where they went home for the summer, a Congress that many people have called a do-nothing Congress. Here you have this national crisis, I think most people would agree, and yet the funding is not there. Although some folks on the other side of this debate say, well, there's still hundreds of millions of dollars left. The government says that money's going to run out. In the middle of this, what difference does that money that the federal government is talking about providing to local folks like yourself and institutions like Northwell Health, what difference does that make in you being able to do your job, whether that money's there or not?
Diagnosing and testing costs money. We know that if we can spend a little bit of money or less money now in terms of testing and diagnosing and following these women and their babies and the infants once they're born with cord blood and placental samples, or we can spend a huge amount of money later. So we're going to spend money. It's a matter of less now or more later, and we know this historically.
Well, where do we stand with the vaccine? Because I know a lot of the money is needed to do that because it's very expensive to come up with a vaccine.
Absolutely.
Where does that stand right now?
We know that the vaccine, it's on everybody's radar. We would like to develop a vaccine. Steps have been taken, but we know that in order to actually develop the vaccine, we're going to need a lot more money.
What about any concerns about a tainted blood supply? I know they rushed into service something that was being used that they say has been effective in finding Zika in the blood from donated blood samples down in Florida. Is that widespread now? Is that a tool that's available here?
We know we do screen our blood supply, period. Blood supplies nationally are screened, but we do know that Zika virus, the particles of the RNA virus can live in blood and semen quite long, and we don't know what that window is. So we do know we need to continue to screen the blood supply. We do know that the Zika virus lives longer in semen at this point than anything else.
So you know, West Nile virus, there was tremendous concern about that, and then it sort of subsided, although people have died from it in this country, but not on a wide scale. Do you think this threat is overblown?
The symptoms of Zika basically are conjunctivitis, which is an eye inflammation, itching, a rash, arthralgias, joint pain, and a fever. So basically we know that these are the symptoms. People may or may not be symptomatic, but all pregnant women should be tested, and I do not think this is overblown at this point. However, I think this is not a cause for panic. We need to stay calm and go with the scientific evidence and make sure we screen our pregnant women.
Well, your calmness is working for me. Dr. Jill Rabin from the Hofstra Northwell School of Medicine, thanks so much for your efforts to protect us all. Thank you very much.
Thank you for having me, Richard.
And